Welcome back to another episode of MedCity FemForward. I'm Marissa Plesha, reporter for MedCity News. Value-based care is a hot topic in healthcare right now, but not always in the context of women's health. That's why in this episode, we're joined by Dr. Keith Berkle, chair of Privia Women's Health, to discuss the need for value-based care models in women's health and the ways Privia is supporting OBGYNs. Hi, Dr. Berkle. Thanks so much for joining MedCity FemForward.
Hey, Marissa, it's nice to see you. Thank you very much for having me.
Yeah, of course. Glad to have you. So maybe just to start, maybe you could just tell us a little bit about your work and Privia Medical Group.
Sure. I'm Keith Berkle. I'm an OBGYN in Richmond, Virginia. My practice, Virginia Women's Center, is part of the Privia Medical Group's Mid-Atlantic market. And since we've been involved, I've taken on some leadership roles with Privia as well. I chair our Mid-Atlantic Board of Governors, and I chair our our Privia Women's Health Board of Governors. And our Privia Women's Health is a vertical of the medical group.
Great, thank you. And yeah, and when it comes to the women's health providers that you work with, the OBGYNs, what are some of the unique challenges that you feel they face when it comes to transitioning to value-based care compared to maybe some other providers?
I think where we've stumbled just a little bit in value-based care in women's health as a whole is that there's not really significant engagement, I feel like, that we get from the payers in helping us develop these programs, right? In primary care, just to draw that contrast, in primary care, our Privia docs have been wildly successful in value-based care. Value-based care is the idea is that we're leveraging outcomes for prioritizing reward as opposed to just quantity, as opposed to just turn as many wrenches as you can. It's really, are we able to prove and to show better outcomes, and that's worth more money to the payers. It saves overall healthcare costs and that sort of thing. And that system is well developed for primary care, and the payers and CMS have worked very hard on it. In women's health, it's sort of been stapled on by the payers and by CMS. It's been hard to convince those organizations that there's some really thoughtful and unique ways that we could execute value-based care in women's health versus the way that it gets executed in primary care.
Yeah. And so in your mind, what does the ideal value-based model look like at a women's health practice?
Well, so I think that it's sorry, I'm going to take a second to organize my thoughts around there. I think that the things that we need to be thinking about in value-based care for women's health are a little different in primary care. One of the things is access, which is important across healthcare for sure. But in ensuring that our patients who are pregnant or are trying to get pregnant, or who have gynecologic issues and things like that those patients are able to make appointments with the doctor they need when they need to see them, and that they're able to make the appropriate follow-up. Pregnancy is a pretty limited period of time in someone's life that we have to help them to really drive positive outcomes. And so access is critically important. Telling someone in primary care that they've got to wait a month for an appointment is different than telling somebody who's 18 weeks pregnant that she's got to wait a month for an appointment when really she needs to be seen in the next few days. So I think driving access is one of the things that we do a really good job with in OBGYN, but that isn't necessarily part of the value-based programs that have come through our commercial payers or through CMS. So I think access is one, and I think, frankly, reimbursement is the other. We've seen our colleagues in primary care really be rewarded nicely for their success in achieving value. In women's health, we don't see those same rewards, and they're tied to metrics that don't always make a lot of sense. in primary care, they do. How'd you do on the A1C? How'd you do on the blood pressure, right? In women's health, it's things like C-section rate, which there's a huge amount of variability that goes into that. It's things like how timely was the initiation of prenatal care, right? And so if a patient doesn't come to us until 10 weeks, we don't have any way of knowing that that patient was pregnant before that 10 weeks. But the programs get dinged. And so the rewards for value-based care in OBGYN are really tied to metrics that are not well thought out. I think that these commercial payers and CMS are thinking about, they're thinking about the way that it works in primary care and trying to translate it, and it's just an entirely different specialty. And these patients, these women deserve a really thoughtful way to ensure that. In big groups like Privia Women's Health, we have put together a bunch of tools to make this really, really easy for our docs to be successful in, right? We've leveraged technology to the hilt on top of our EMR, which prioritizes ease of scheduling and ease of billing and all of that sort of thing. We've laid on top of that additional technology offerings that bring the prenatal record right into view, right, sort of front and center for the provider, that has some decision support based on evidence that the doctor can use to make sure that, for instance, this patient's got gestational diabetes or she's hypothyroid in pregnancy. We've got the tools that input all of that data right into the chart so that we can be sure we're doing the right thing for this really, really diverse group of patients. We also have spent some time working really heavily with another vendor who provides a patient-facing education app that all of our patients have access to, that gives them sort of week by week advice and education and instructions and pearls and things like that for their pregnancy, but through which we can also perform remote patient monitoring, right? We can have our patients check their blood pressures at home, and that information goes into that patient-facing app, and it falls right into the prenatal record that is the EMR in front of our face, and so we can know what's going on with this patient, even if she lives 50 or 60 miles from our office. We can make sure that we're keeping a close eye on her health through all of that. And so we've leveraged a lot of that technology to make sure that we can that we can make as much a difference in these pregnancies as we can. But none of that is what kind of gets we get credit for in value-based care. We get credit on whether or not we did a C-section on somebody with breech twins, right? That's a black mark, which is silly.
Yeah, some really interesting some really interesting comments there. I going off of that, I want to ask you about the women's physician advocacy committee that Privia has. Can you talk a bit about what this committee is and why it was created?
Sure, I'm happy to. My colleagues within Privia, particularly Dr. Zia Khan, Dr. Sumi Sexton, Dr. Caitlin Zahner, put together the Women's Physician Advocacy Group, and this is a group that really looks at what are the challenges women who are physicians. I'm a women's health physician, but I'm not a physician who's a woman. Physicians who are women face different challenges a lot of times than physicians who are men, particularly physicians who are women who own their own practice and who maybe are the only provider in their practice. I think that group kind of coming together to look at those issues and think about how do we address some of this, really, it sort of ties in nicely with our women's health mission. I don't want to take credit for Dr. Khan and Dr. Sexton and Dr. Zahner's work, but I think that it's a fantastic organization that they've put together to really look at that. I'll share with you, if it's okay, what we've learned in some of our, from a Privia Women's Health standpoint. We've looked a lot at equity among payment in different specialties and that sort of thing. And what we've learned is that there really is a disparity in sort of anatomically matched procedures that are performed on women versus those that are performed on men. So doctors that are operating on women, which by the way, I'm a minority in, most OBGYNs in 2025 are women. But as a specialty, we earn a percentage less than our colleagues in urology, in general surgery, and certainly in orthopedic surgery and other subspecialties like that. And I think that speaks not only to sort of a legacy, of last 100 years of valuing the care of women a little less, but as we recognize now that the majority of the physicians affected by this are in fact women, there's an equity issue there as well. So I think the Women's Physician Advocacy Committee goes a long way towards helping us put some tools together to address that with our commercial payers and with CMS and the RUC committee and all of the above.
Yeah, yeah, and you mentioned some of the tools that Privia offers to support women's health physicians. Can you go into a little bit more detail on some of those specific tools?
Sure. So we talked about the pregnancy tracking, the education app that we've got to keep patients just kind of informed on what to expect, to allow providers to share kind of this gestational age specific information with their patients. Some of the other tools that we've put in place are some partnerships with several vendors that provide virtual care for lactation support, right? For patients who are thinking about breastfeeding after they deliver, or who have delivered and are in crisis mode in the middle of the night and can't figure out what to do. We've got virtual support for those patients, face-to-face support right on their phone, right? We've got nutrition resources where we've put together some really healthy partnerships with registered dietitians who specialize in women's health and who specialize, frankly, in prenatal nutrition and gestational diabetes that we've got that our patients all have access to through our platform. And we've also partnered with Frame Fertility, who provides virtual fertility care. There are a lot of patients in that category, right? For whom we don't always have, those of us who aren't subspecialty trained in fertility, we don't always have those answers. And so being able to put those tools, fertility tools, lactation tools, nutrition tools in the hands of our Privia Women's Health patients has been critically important, especially for patients that have traditionally had more trouble, I wouldn't say denied, but have had more trouble accessing that kind of care, right? So particularly minorities and particularly Medicaid patients have frequently had a lot of trouble accessing that kind of care, and we're working to bring that to them, to meet them where they are. I think the biggest workhorse in our sort of quiver is our EMR and the extensive work that we've done in optimizing it for the delivery not only of prenatal care but for gynecologic care, right? For assessing masses in the ovaries and fallopian tubes, what we call adnexal masses, right? For assessing heavy menstrual bleeding and who's a candidate for which intervention and how should we be thinking about that. And certainly also Privia has a large clinical research footprint. And so as we grow the ability of women's health researchers to access the huge number of patients, Privia across the country, Privia takes care of about 5 million patients. I'm not sure exactly how many of those are women's health patients, but you would guess around 50%, right? We've got a huge number of patients that may be eligible for some of this research, who can really learn something from and who can be part of building their healthcare future through clinical research.
Yeah, interesting. So in the next 3 to 5 years, what are some things that you hope to achieve in the women's health space, whether it's with the advocacy committee or in working with these OBGYN providers and transitioning to value-based care?
Well, a couple of things. First of all, we've gone a long way already towards developing a sort of a national women's health platform that our docs from across all of our markets are able to access and use to take good care of their patients. I would very much love to grow that platform, to lean in. It's hard to imagine we've got something less than a perfect prenatal monitoring system right now, but I think there's room to grow on that. I think we could get a little better in how we engage specialists, how we engage maternal fetal medicine specialists, how we engage neonatologists, pediatric cardiologists with all of that. So I look for those associations with deeper subspecialties as we continue to grow. I think that I would really love to be able to have a better seat at the table, for Privia Women's Health to have a better seat at the table with our commercial payer, friends, and also with our friends at CMS, to really talk about what meaningful value-based care in women's health looks like. I would love to see value-based care in women's health look like something other than a side project that they let an intern take care of, right? I want it to be something that the folks that have figured out how to do value-based care and primary care so effectively have a hand in. But I'd like for us to have a hand in it too. I'd like for the women's health physicians to have some input in it. I'd like for our docs to help decide what that should look like, because I think we take really exceptionally good care of patients, and I think we can grow that really, really effectively. Those are a couple of the things. As far as the Women's Health Advocacy Committee goes, I'm excited to see that group continue to grow. I'm excited to use what they learn to help us make sure that we're not only seeing equity for our women physician colleagues who are in other specialties, but that we see it for the women who are practicing OBGYN, because I think that they deserve it. These are the hardest working people in show business, for an entire 9-month pregnancy to pay about what a hip replacement pays is a disservice, I think, not only to patients, obviously, but to the provider who pours their heart and soul into that, who delivers this baby at 2 o'clock in the morning, who works so hard with these patients to laugh with them and cry with them and make sure that they have as healthy an experience as possible.
Yeah, very well said. And going off of that, outside of Privia, what are some broader things you think the healthcare industry needs to do to advance value-based care models in women's health?
But that is a huge question, Marissa, and I'm happy to give it a shot. Right, I think that I think that we have dialed in on how to, as a healthcare system, right, on how to incentivize doctors, particularly in primary care. We've sort of proven the concept in primary care. We've dialed in on how to incentivize doctors to really look at the metrics that matter, and to make sure that they're providing relentless access to their patients, right? And so I think growing that, and I think I'm not one of these folks who thinks we should completely get away from commercial payers and privatized healthcare and that sort of thing. I think all of that's part of the system that we work in, right? But I think that helping these private payers also understand that working towards better outcomes as opposed to working towards more volume and saving a buck is the best way to manage this. When we see our doctors work towards better outcomes, we see fewer emergency room visits, we see fewer ambulance calls, we see fewer untimely deaths, we see fewer extended hospitalizations because of complications, for instance, from diabetes or from end-stage kidney disease. And I think that if we can convince our partners in the commercial payer world and convince CMS to continue, right, that aiming towards outcomes as opposed to aiming at what your P&L looks like is going to ultimately save healthcare dollars and hopefully, not to be too dramatic, save healthcare in America, right? We've got kind of a bad rap.
Very well said. Well, Dr. Berkle, this has been such an interesting conversation. Thank you so much for joining.
Well, it's been my pleasure. Thank you very much, Marissa. Anytime.